I'm Dr. Regina Nelson. Welcome to Ask Dr. Reg. Please like and subscribe. I need the help getting things moving forward. But today I'm asking a question that came across my email from a woman named Tana. I have a cousin named Tana. But she wanted to know really what is the best way to incorporate medical cannabis into her treatment plan as a BII Asia patient. So Tana, first I'm going to explain to everybody else. BII stands for breast implant illness, and Asia is autoimmune syndrome induced by adjuvants. Adjuvants are implants, breast implants, dental implants, vaginal and hernia mesh, metal clips, pacemakers. Some people, more than others, have some severe reactions to these things, and I can now very clearly roadmap my first metal clip and the beginning of autoimmune disease. And so I've written about this in a book called Implant Insanity. It's why people like Tana are reaching out to me, and I thank you, Tana, for that. She's been recommending the book to other friends. Hopefully they're hitting me on Amazon, but you guys can check my website. I've got them there too. But what is the best way? Well, if you've already got a plan going on, whether it includes detox this week, nutritional supplements, whatever phase of your treatment that you're in, that you're trying to do, you can add cannabis. It's a matter of setting a plan. And again, I think the Survivor's Guide to Medical Cannabis, if you're looking for a book to walk you through that, is the best way to go. I also have journals that are available, though, that you can just sit down and answer a few questions and figure out where you're at, what you need, and kind of begin from there. And you can add your other things in there, other nutritional supplements, again, that you may take. There are a lot of people who are going through autoimmune illness, and they have implants, and they haven't associated those facts. Tana has recently. And I'm going to answer her detox questions in another video, so keep your eye out for that. But I think it is just set a plan and begin it and track those things. I think it's really important when you're suffering from illness and you're treating yourself with some new treatment of any kind, to be journaling and just tracking what you're doing. Because some days you're like, I don't think this is working, but you look back over the week and you see you really had a pretty good week. You're just feeling extra crappy today. Maybe it's because you felt better the last few days, and now you need to think, am I better or am I worse? Is this my normal crappy? Am I extra crappy? Have I been feeling better? Journaling really helps you see patterns and trends that you might not be able to see. So begin slow. Take it slow. Go follow the advice in the Survivor's Guide. But just add it to any treatment plan that you're already doing. If you're on pharmaceuticals that say do not take with grapefruit juice, then don't mix that, particularly with a high CBD regimen. Doesn't mean you can't start at a small level, but you need to be weaning from one to begin the other. That's the major drug interaction that you may or may not have to deal with. You may not. Tana and I have already kind of gone back and forth. She's had these questions answered, even the detox ones, before I've come to you. And she's given me permission to put this out here. So thanks for joining me. And if you want to send me a question, you know you can submit it for free on my website and be done with that. And I'll reach out to you and let you know when I answer your question and give you a link to the YouTube video. But sometimes I'll send somebody an email and they email me back and we get to talking. Tana and I actually have now scheduled a patient appointment, and we're going to talk next week. And that's something that I do with a lot of patients, particularly those that are new to cannabis therapy. If you're new and you're worried, have some worries, have some concerns, have some questions, reach out to me. I'm here to help. It's Dr. Reg. Don't forget, check out my website. Check out the Cannacian Leadership Academy. We need more people like you in this space. Come and help me.